Hello, and welcome to another edition of BNEWS In Depth. I'm your host, Rich Hosford. Part 2 of Phase 2 of Massachusetts' rollout of the COVID-19 vaccines is underway, allowing people 65 years of age and older and those with 2 or more health conditions listed by the Commonwealth to seek vaccines. But many people are having problems getting appointments, and to the frustration of many local office officials, the state is prioritizing mass vaccination sites like Gillette Stadium and Fenway Park over local boards of health. That is the focus of our show today, how the rollout is unfolding and the situation with local municipalities and their readiness to administer doses. We'll take this conversation in 3 parts. First, we'll speak with Burlington Health Director Lumenello and Board of Health Chair Dr. Ed Weiner about Burlington's ability to give out the vaccine, if only it had some. Then we'll talk to State Rep Ken Gordon about communicating with Governor Baker's administration about getting vaccines distributed locally. Finally, we'll talk to State Senator Cindy Friedman about her thoughts on the situation and her claim that the state has a lack of a feasible plan. We have a lot to get to, so let's get started. And I am now joined by Dr. Ed Weiner, Chair of the Board of Health here in Burlington, and Health Director Susan Lumenello, who I've been speaking to more than ever the last couple months. Thank you both for joining me once again. I appreciate you spending the time.
You're welcome.
Thanks, Rich.
So since the last time we spoke, and to set the context, that was when Burlington was set to receive 100 doses per week for a vaccination clinic. Even that has gone away. Talk about just the changes at the state level that we're seeing now.
So last week, local boards of health were notified through a letter from Secretary Sutters that we were no longer going to be receiving allocations from the state, and the allocations that the state government was receiving were going to go to the mass vaccination sites rather than to local boards of health.
And what do you make of that decision? I know, especially right now, we're in the phase that we're in, we're trying to get the vaccine out to people 65 and older. The mass vaccination sites are not necessarily in their communities. So what are your thoughts on, the prioritization of those sites rather than, local senior centers or local high schools?
So let's put this in context. It may work for those people who are not sick. It may work for those people who are not elderly. It may work for those people who are not homeless and disenfranchised. It doesn't work for those people who can't travel, who are too sick to travel, those people who have no transportation, and those people who can't find a way of getting 20 miles to a site. And most of all, try to get on a website that absolutely doesn't work. I tried multiple times this week to get on the website. It doesn't work. I called 211 and spoke to a representative and asked them one question. You're supposed to be able to help the elderly and those people without technology. Have you made one appointment today? And they avoided the question. Just one. Just tell me you did one. Tell me that the people in Capitol Hill are on this. That representative could not answer that question. Since we talked, I've been on Channel 7, WHDH, BCAT. Thank you very much, BCAT. The Herald, the Globe, the Patch, the Times-Union, all saying the same thing. We need local boards of health who have the ability, who have the expertise. Local boards of health, like Burlington, that has a 300-person medical reserve corps, who can dispense up to 800 doses per week. We need to be able to help our own and neighboring communities.
Yeah.
Rich,
Yes, Susan.
one thing that gives us an advantage too is we know our community, and people know us. So when we did those 100 doses for our seniors, our most vulnerable population, the 75 plus year olds, we had the senior center help us out, and they were able to call people and give them personalized instructions on what they needed to do and sign them up on the software and give them rides to 61 Center Street so that they could get vaccinated in a place that is familiar to them. So we heard from people that came to that and just thanked us so much for doing what we were able to do. And we want to be able to continue to do that until there's no longer a need for it. People are more comfortable coming here. And some people have even said, you know what, I'll just wait to get vaccinated instead of going to one of these large mass vaccination sites. And that's what we don't want. We want people to, if you're eligible, to get vaccinated.
And talk about the capacity that you have, so if Burlington had, as many vaccines as, it was hoping to get, what would that look like?
Well, 3 weeks ago, we asked for 800 doses. Each week subsequently, we've asked for 800 doses. And you know how many we've received? None. We don't even get a communication that tells us we're getting none. The policy for the Massachusetts Department of Public Health is, if you don't hear from us, then you're not getting anything. What a horrible policy. And we haven't even finished our over 75s. And they've announced for 65 and those with multiple comorbidities. Yeah, I understand. But look at other states. Connecticut today announced that they're going to inoculate people over 55 starting next week. We can't even get the first round accomplished. I don't know why.
And Susan, to that point, but if you were able to get the 800, how would it work? Would it be still at the senior center? Would it be at the high school? What would be the process? Looking ahead, when doses maybe become available, sort of what are the plans that you have for, larger clinics?
So if we were able to get 800 doses, we feel that we could do 800 doses in one day. And it would be at the high school. And we would need to get approximately 12 to 16 Medical Reserve Corps dispensers to do 800 people in a day. And we also have our school nurses who are willing to help, EMTs from the fire department who can help dispense. So we don't think that it would be an issue getting the number of people there to dispense and the volunteers needed to get 800 people through the clinic. So if we could get 800 doses, we could do 800 people in a week. On a weekly basis at the high school.
And I'm guessing that people would be able to wait inside, unlike, maybe at Fenway or Gillette. It just seems like you're asking seniors to go stand in the cold at these mass vaccination sites.
Yeah, it would be by appointment, and we'd bring people in during their appointment time. Of course, we need to make sure that it's safe for everyone and everybody is socially distanced. So having an appointment time helps with that. And we would have a waiting list. So we wouldn't say stand in line if we have any extra doses, come in. We would have a waiting list and an ability to call people up on the waiting list if we did have extra doses. So that would eliminate anybody waiting outside trying to get a dose.
Right. Yeah.
We have a plan. We've already done 11 clinics, 11. They've worked perfectly. We can do it.
And now I know there has been talk about regional sites, maybe teaming up with some of the other communities in the area and having, a site that would be continuous. I know that's one of the requirements from the state. Talk about some of the issues with that, though. I know it would be a regional site, but it wouldn't necessarily be for regional residents.
Well, Susan has been in contact with a number of our communities, but that's not exactly what the state wants. The state wants us to get together with a number of communities and build a mega site, not for our community and not the local community, but for the whole Commonwealth, which means that, let's say we put together a site that could do 800 doses a day, but there may be nobody from our own community who could attend because it has to be opened up to the complete Commonwealth. If we could do that type of a program and keep 100 spots a day for local community people, that would work. But that's not what the Massachusetts Department of Public Health wants us to do. They want us to build a mega site for everybody. So, which means we could have everybody from Western Massachusetts come into Burlington and nobody from Burlington at that site.
Right. It would just be first come, first serve on the website or the hotline.
Mm-hmm.
Correct.
Okay.
It would be just like another mass vaccination site run by local boards of health rather than by Department of Public Health.
Okay. So it doesn't really solve the issue of, having people get vaccinated in their own communities by people that they know and trust, which seems
correct. Yeah, and if you're doing a collaboration, say you're doing a collaboration with, I don't know, 10 other towns, that doesn't necessarily mean it's going to be in Burlington. It could be in one of those other towns.
Right. And just looking ahead, I mean, I know things are like in a sort of a bad place right now, but hopefully the Johnson & Johnson vaccine is going to be approved for emergency use. Do you see any sort of, glimmers of hope coming down the line? Do you think that the situation is going to improve, or what can people sort of expect that are watching this?
Well, first, tomorrow, the Senate and House of Representatives had convened a oversight committee to confront the governor and the Massachusetts Department of Public Health. At least 50 plus senators and representatives have signed a letter to the governor asking him to reconsider. Whether he does that or not, I don't know. But I do know our town representatives, or those who represent this town, both Sidney Friedman and Ken Good, have been trying. The governor just doesn't listen. And it's really sad. It's really sad that I have to go outside and be confronted by elderly people saying, what am I going to do? It's sad when we can do it as good as, and in some cases, better than the Commonwealth.
Right. I mean, because it is, I think a more controlled environment, doing it at the high school rather than some Fenway Park or Gillette Stadium.
And it's not costing millions of dollars to do it. Our Medical Reserve Corps, those are volunteers, free. Our dispensers are free. We don't have to hire Curative or any of the other third parties. We have people in place. We have a fire department, a police department, a DPW, get on in a school department. I speak to the chairman of the school committee all the time. We've everybody in place to do it. It won't cost the Commonwealth anything. That's why it's even more frustrating. They'd rather spend money with third parties than let the communities do it, for all intents and purposes, free.
Right. Susan, you were going to chime in?
Yeah, I was just going to say, we want to make it convenient for people. We don't want people to have to take, half a day off of work or waiting in line or trying to find appointments or having to go to one of these sites further away. We will get more people vaccinated if it's more convenient for them. So moving forward, as vaccine supply increases, which, we're hoping it will, and that we're going to continue to get more vaccine and there will be more approvals in the future. We want to make this convenient for people so everyone will get vaccinated. So if they can come to their, place where they reside or where they work and spend an hour rather than half a day to get a vaccine, that's what we want. So we want to be able to do this for people in where they live and where they work.
Right. And I guess sort of like just kind of wrapping up, what is the next step for the two of you? I know you've been lobbying, been trying to, pressure the state or the administration. Like, where do you see yourself, your activities in the next, couple of weeks as far as this goes?
The Board of Health continues to do what it has to do in a pandemic. And that means everything we've had to do prior to, and all of this and all of these issues on top of that. We just got to stay on. We got to stay on Cindy Friedman. We got to stay on Ken Gordon. They represent us at Beacon Hill. Everybody should give them a call, just that they know that they're worried about this too. I don't know where else to go. As I said, I've been on almost every media, and Susan has done everything she's could. Also, I don't know what else to do except stay on these people and keep speaking out. Someone needs to speak out for our community and not stop speaking out for our community. And maybe I irritate people at Beacon Hill, but that's okay, because I am representing this community here. Community, these are my neighbors, these are my friends, these are my colleagues. This is my town. I'll keep irritating them.
And Rich, we're going to continue to keep planning and keep being prepared. So we are always planning. We're always looking for volunteers to help out. So if anybody wants to help us, please go to maresponds.org and go to Region 4A and sign up for Burlington Volunteer Reserve Corps. So we're still taking volunteers. We want people to be ready in the event that we can move forward with this.
Okay.
One comment, Rich. We have been drilling for more than a dozen years for this type of a situation. And now that it's here, we'd like to be able to put in practice everything that we have done and put in, and all the processes that we've developed. It's just frustrating for everybody.
Right. Yeah, I know you set up the flu clinics as like training for this. I understand that, and I imagine that it is, when you're feeling ready and you're able, just not to be able to do it must be a difficult situation. Well, I think we've hit all the major points. I know you two are both very busy, and I appreciate you once again coming on to BCAT and talking to us about, this issue and all things related to the pandemic. You're always very available, and I highly appreciate that.
Thank you, Rich, and
Thank you, Rich.
BCAT. Thanks, BCAT.
All right. Well, I'm sure I'll talk to you again soon, and until then, stay healthy and stay safe.
Thank you.
Thank you.
We go now to my conversation with State Rep Ken Gordon, who has been working with local officials to try and get vaccines distributed locally from the state and the obstacles they have been facing in that effort. Let's take a look. I'm now joined by State Rep Ken Gordon, who's going to talk as best he can about the situation with the vaccines, but there is a lot of unknowns out there, so we're going to give everybody a lot of space to sort of try to figure things out as we go along. Ken, thanks for joining me today.
Thank you, Rich. Thanks for having me.
So first off, just from the communities that you represent, what are you hearing from them as far as like their readiness to distribute vaccines, their willingness and their ability to do so?
Clearly, the communities I represent, and specifically the two that I represent entirely, which is Burlington and Bedford, are prepared and have prepared for a situation like this. I should say, a healthcare crisis that the virus has presented, and then the way to address it through the vaccine. So they've been ready, waiting, they're prepared, they're willing to do it, they can do it, and they've been doing the responding. Each of these communities, Burlington and Bedford, have requested hundreds more doses of the vaccine. Back when the boards of health were able to administer these doses, they were each given their share, which is 100. Almost all of the municipalities around us were receiving 100. So I understand there was sort of an even distribution. The problem is that they're now receiving zero, and they've been told by the administration they won't be receiving any more doses for the foreseeable future because the administration is concentrating the administration of these doses to the mass vaccination sites, which you mentioned, which is Gillette, Foxborough, the Doubletree in Danvers, and soon to go online, the Natick Mall, and a few others.
Yeah, and did you like get any sense of, what sort of change? Because I know like in Burlington, like you mentioned, they were asking for more. They wanted 800, they got 100, and then they got a week of zero, and then, fortunately a local company was able to step up and provide Burlington with another 100 for the people who had been scheduled. But, do you have any sense of, sort of what happened and why it went from, a possibility of many hundreds to only a very small amount of 100 and then nothing?
Well, the reason I think that it started at 100 was just supply. The supply chain was affected. So we had just so many doses to distribute among the Commonwealth. And as long as everybody's being treated fairly, I think we could understand that. The issue that you raise is, okay, how did that change? And I think that one of the reasons it changed was that some municipalities were better prepared to administer the vaccine than others. And so the solution that the administration seems to have come upon would be to consolidate those vaccines in these mass sites, so that at the end of the day, all the vaccine would be used. That was the theory anyway. What we've been reading about is that, for example, there were vaccines, and I think the Globe reported 1,500 that weren't used in one of these mass sites, because that might be the theory. Then let's put them all together. That might be a proposed solution. Well, it might be a solution they've tried. But what that means is that you are requiring the people receiving the vaccines, which in this case are seniors over the age of 75 and older, to go there. And our seniors don't want to go there. Right. Even if you could provide transportation for seniors to get there, they still don't want to go there. So I think there were other solutions that weren't tried. One would be, and it's being discussed now, is regionalization. More than discussed now, it's proposed by the administration that if a municipality wants to regionalize, cooperate with other towns, then maybe if some of the towns within that region are prepared to administer the vaccine, others aren't, then the ones that are can get a larger number of doses and administer within the region. The problem with that is that the rules provide that if you do that, then you have to, for number one, there's no guarantee of how much you will get, how much vaccine you'll get, and number two is you can't just restrict it to people in your region. So people
Right.
come from outside the region, and then if, for example, Burlington was to organize this at this point, the way that it was rolled out, Burlington wouldn't know if Burlington residents would be first in line or last in line. So it's got to just be, the rules have to be better set out to motivate a town to do that.
Right, actually, yeah. So we're taping this on a Tuesday, and last night at the Board of Selectmen meeting, I think Town Administrator Paul Sagarino talked about that. There was a, discussion of, kind of hooking up with Lexington and Acton and other communities to form that, like you said, regional vaccination site. But that was one of the issues that he raised as well, is that, you'd get people from all over the state coming in, and that's not something that you can control for, really. Well, one of the things that you mentioned, with the focus being on these mass sites, which, Gillette, Fenway, things like that, I mean, it is sort of, I think, perhaps daunting for people 65, 75 and older to sort of, venture out during a pandemic, during the winter, to go, to these big places that are mostly outdoors. Do you have any sense of why the administration thinks that, that is the way to go rather than like a local senior center, local high schools?
I can't and really don't want to answer for the administration because, you've printed the letter that I've written to the administration complaining about that. And I'm not the only one. The majority of my legislative colleagues have written to the governor complaining about that and other things. And we've conducted an oversight hearing. Our COVID-19 committee, together with public health and other committees, are going to be asking some serious questions on this coming Thursday. The governor is appearing, and the Secretary of Health and Human Services, Mary Lou Sudders, is coming to testify to answer those questions. What's the strategy behind that? What I've heard again is perhaps consolidating the vaccine in one place will allow for more of it to be used. The little dribs and drabs won't be left over, I guess. But again, that would be a problem if vaccine was left unused. I'm not sure that this is the most effective solution to that, especially for our seniors. I think it might be different. When I wrote to the governor, I said this is a premature solution, among other things I said. But the reason I use that word is maybe when we're vaccinating the population in general, we get down to people in their 30s and 20s and all that, and the weather at that point is nicer. It's the late spring or so. Maybe it'd be kind of cool to go to Fenway Park. I'd rather go there to watch a ball game, but that's just different because right now, like you just said, Rich, it's wintertime. Parking is hard. It's a distance away. It's just, I have more questions than answers.
Understandable. And you're right. I am always excited when I go to Fenway, and mostly to see a ball game. But I would be very excited to go get a shot once or twice there, actually.
Twice. Yeah.
One of the things that we had talked about for a previous piece that I did on this, and I think is probably kind of the crux of it, is just not so much like blaming anybody for like not having enough vaccine. That's probably something more on the national level, but it's just the communication. I mean, talking to Dr. Ed Weiner of the Board of Health here in Burlington, he seems to be more frustrated by the lack of information almost as much as the lack of vaccine. Do you feel the same way?
I do. Yes, we're learning things sometimes on the fly as legislators, and that's not productive. Announcements are made, and we're told maybe an hour or two in advance of that. And it's happening with some frequency, which is one of the reasons why we've conducted this oversight hearing. And our towns are being told sometimes without enough time for our towns to prepare for things. And sometimes it's inconsistent information. So yeah, certainly communication is a big problem with this, and also related to that, the technical aspect of the website. So we were dealing with the problems of bringing the vaccine into the mass vaccination sites, away from our towns and away from our healthcare locations like Leahy or Emerson Hospital. We haven't even. There's so much to this, we haven't talked about that yet. But people are comfortable going to their primary care physician to get the vaccine administered by likely a nurse at that place, but they're going to the places that they're comfortable. And now they're not administering the vaccine because they're not given the doses either. And so those changes have occurred. Lack of communication, but also, what about the website? I mean, we keep getting complaints, and I understand it because I go on the website just seeing how it works. And it's very, very frustrating when something says there's an appointment available after you hit refresh, like you're buying tickets to a concert on Ticketmaster, and then it comes up, and then you find out now it says 0 again. It's inefficient. It's frustrating. It's frustrating for all of us. Let alone we're talking about administering it again to our older seniors and our 65 up seniors. So no matter how nimble you are at managing through a website, it's very inefficient. We'll be asking those questions on Thursday.
Okay. We'll definitely have to tune in on Thursday. And I mean, I know that they've also launched the, after you and others sort of prompted them, they launched the phone line to call in. Have you been hearing, is that working any better? I've heard of long wait times on that as well. Well,
the only reason I can say maybe it's working a little better is that we receive fewer complaints about that. So it's hard for me to answer that. I hope it's working better, but I'm not sure that any of it is working well because nobody's emailing us to say, I got through and it wasn't, a terrible hassle. Some people are getting through, by the way, and some people are getting appointments, and we see that on social media, and I'm glad to see that people are having patience and getting through. And I also want to make sure that folks understand that vaccine is being created and delivered it's being created every day and delivered several days a week, if not every day, but at least several days a week. And so we'll get through this. Folks are frustrated because they're not getting their vaccine now, and I understand that because we've been kind of cooped up for the better part of a year now, and we can't wait for it to end. But the supplies chain is lightening up. The supplies are increasing, and when the Johnson & Johnson vaccine is out and ready, it'll increase even more. So there'll come a time when this is in the rearview mirror, but that time isn't now, and that doesn't make us feel better now. And so, as we're doing this interview, like we've said, we're 2 days away from this hearing, and hopefully we're, not too long before the supply chain opens up so that there's more and more vaccine. And hopefully some of the places like our healthcare institutions, our hospitals, can start getting the vaccine again when it's more plentiful.
Right, like, because as you mentioned, they originally were, and now they're, seeing a sort of a lack of vaccine coming in too, like Leahy and Emerson. Are you here? So, do you get any word from the administration about sort of what's happening at the national level that's impacting Massachusetts?
Well, what we get, and also the public has access to this information too on the COVID-19 website. So we get reports of this is the amount that we've received. This is what we're getting now. This is what we're distributing. All the percentages that come in, and so that's updated regularly. And that's the information that we receive as well. We do have our conference calls with Secretary Sutters weekly, and we do get updates. Sometimes, like as I said before, that doesn't mean that the update isn't updating something that's going to happen in a few hours. Mm-hmm. But we do have that access to have conversations.
Okay. Well, so it's basically just you have the information that we all do, and we're all just sort of waiting for the vaccine sort of distribution just to open up and hopefully get out to everybody in a more efficient manner coming down the line.
Yeah, when we're having these meetings, we're not being told anything that the public isn't being told.
Okay.
It is on the website. It's just a question of the secretary being available for questions. But the answers are similar to what I've just told you. They're really not particularly getting to the heart of, opening the locks that are confounding us right now.
Right. So kind of as we, and go towards, wrapping this conversation up, just wanted to sort of change a little bit and just talk about, so we're still, obviously, there are restrictions, there's lockdown, there's, limitations on businesses and restaurants. How do you think overall the strategy of the state is working out? I mean, a couple weeks ago, capacity limitations were lifted a little bit to 40%, I think, for restaurants and businesses. Are you hearing anything locally that businesses are improving at all, or how do you kind of generally assess the situation we're in right now?
I think you're asking me, vaccine aside, how are things going?
Yeah, pretty much.
Yeah, and it's very frustrating. So locally, the businesses are still under a tremendous amount of stress. Restaurants are, the capacity where they can operate is just insufficient for them to pay the bills, to make ends meet, let alone make any money. We are able to legislatively solve some of the issues. We passed legislation recently that addresses the fees that are charged by the delivery services. They used to be up to 30% that they were charging the restaurants to take meals to people. This is a service that's become very important. This is the DoorDash and Uber Eats and these companies, and it's very important for people who aren't able to get out. On the other hand, if they're charging the restaurants 30% of the revenue that they're receiving, then the restaurants aren't making any money. They're just doing it to keep cash flow coming through. So we put a ceiling of 15% on that. So it's an example of the things we're trying to do to address this crisis as it's ongoing, the vaccine and all the once we get that will hopefully get us past the crisis altogether as we can venture out once a significant number of us have been vaccinated.
Right.
So, yeah, we're, overall, we've had to shut down the businesses. Well, we've had to restrict the businesses to keep us safe, and businesses are cooperating. People, by and large, are abiding by the mask wearing restrictions, and we're fortunate that way. That I think that our community really does take that responsibility seriously. I don't see that many people ignoring that, distancing and washing and things like that. It's important now, and it will remain important for quite some time, even as the vaccines are administered to our residents.
Right. I mean, all the talk of vaccine, I mean, that's good and it's coming, but like you said, there's still people struggling right now and things that need to be addressed. We can't just sort of hold on and wait for a vaccine. We got to keep kind of surging forward despite, any sort of issues with the distribution. So.
Yeah, I mean, Dr. Fauci has said that the most effective tool against the virus is the mask. If everybody wore a mask nationwide, the incidence of the virus would come down even before everybody gets the vaccine administered. So if we continue to really pay attention to that and have that discipline to respect that tool, we'll be ahead of the game.
Yes. Wear your masks. We all have them.
There you go. I'm in my home office, or I'd reach around for one too.
Yeah, in your own house. It's fine. As soon as I leave, the screen studio, I'll be wearing mine again. Well, unless you have anything else, I know we should people will be seeing this afterwards, but we'll touch base after Thursday's hearing and sort of get an update of, how that went. And I appreciate, all the time that you take sort of keeping us updated and informed about what's going on.
Yeah, I mean, we really understand. We do receive a lot of emails, almost, all of them expressing some degree of frustration with this system. And we're glad to hear from our constituents, but understand, whether you're emailing or not, we really understand the frustration that people from our communities are feeling over the rollout of this vaccine. And we're trying to do everything that we can to, discuss with the administration what we can do to make it more efficient, to get this to you, and get it rolled out in a way that is understandable, is clear, and we can comply with. We can, the administration can come up to us. Mobile vaccines are another thing that we're talking about. Just making it mobile, bring it up, and bring it to our communities where it's safe and effective and convenient for people.
Excellent. All right. Well, I very much appreciate you taking some time today, and I hope you stay healthy and safe, and we will talk again soon.
Same to you, Rich. Same to Joy, and thank you very much for the interview.
Finally, we go to my talk with State Senator Cindy Friedman, who said she has also been working to get vaccines to the towns in her district, but has been frustrated by a, quote, lack of a plan by the state. Let's check it out. And I am now joined by State Senator Cindy Friedman, who's going to talk to us about her perspective on this vaccine rollout. Senator, what are you hearing from local communities about their thoughts on the prioritization of the vaccines going to places like Gillette and Fenway rather than local Board of Health?
I am hearing a lot of upset and a lot of frustration. I'm seeing that there are a lot of people being left out of that focus that the governor has applied to the vaccine rollout, that the focus be on speed and large sites versus community and hospitals and local boards of health. So I'm hearing a lot of concern.
One of the things that I keep kind of hearing, and maybe you can so obviously in the first couple of phases of this phase 2 or the parts of phase 2 was prioritization of seniors, 75 plus, and then now 65 plus. What are you hearing as far as that kind of population and their sort of willingness and interest in going into Boston or going down to Gillette, rather than going to their local senior center or high school?
Right now, the numbers that we're seeing is about half of the 75-year-olds in Massachusetts have been vaccinated. And so most of those people have been vaccinated. A very, very large portion of those people have been vaccinated in the mass health sites. So gives you an idea, the mass vac sites, gives you an idea of how many people are not vaccinated. And I maintain that those people, those 75-year-olds, are people in communities who can't use the internet, are having a lot of trouble navigating it, don't have even internet access, can't drive, have no idea what it means or how they would navigate to a Gillette site or a Fenway Park, have connections with their councils on aging. And I think because of how the administration had set this up, there was an expectation that those entities would be part of the vaccine process, and now they're not. And so I think what you're seeing here is that there are a lot of people in these cohorts that need to be vaccinated and aren't getting vaccinated.
Yes, I've heard a lot of issues with the website and even long wait times on, with the phone hotline that was set up. So I think there's a lot of people who are, experiencing some frustration with the system. Now, I know in Burlington, they've been using the flu clinics for the past decade or so as sort of a preparation for, this type of situation, a pandemic where they had to mass vaccinate people. Your district is obviously beyond Burlington. Do you get the sense that most of the communities that you represent are sort of, ready and able to, distribute the vaccine if it was available?
Yep. I have no question that certainly the towns in my district could absolutely distribute the vaccine. I mean, it's not, it is absolutely true that this isn't like a flu vaccine, right? It's much different. But I think they absolutely were prepared and are prepared and have done a lot of vaccines. They gave vaccines to first responders, to healthcare workers in the community. So, they've proven that they can do it. I have no doubt that my communities could absolutely handle this. And they could handle a lot more than they're getting.
Right, which now is pretty much zero.
Which now is none, right?
Yeah, I mean, it was 100 when I know in Burlington they were looking for 800 and they were getting 100. But,
yeah.
And any thoughts or discussion? I know it got brought up at the recent selectmen's meeting of a regional vaccination site, but I know there's a lot of difficulties with that. You can't really control who would sign up for it. It's kind of, the state doesn't seem to have a lot of interest in setting up other, new regional sites. Any discussion on that front?
So I believe that today the governor has announced an additional, I think he set up 4 regional sites.
Okay.
And I haven't had a chance yet to look at where they are. I know that one of them is in Massachusetts between Worcester and Pittsfield. I think it's in Franklin County. I believe it's Franklin, Hamden or Hampton. And they had 500 vaccines delivered to them. They had 500 vaccine slots, and over 450 of those slots were taken by people that lived Worcester East. So
okay,
that to me is not a regional site, right?
No.
That to me is just another site that people who are able can access. Community health centers, I was talking with one of the community health centers, large, very competent, very successful community health center in one of our most affected communities. And they have to be open to everybody. They've given out about 6,000 vaccines, and less than 38% of those vaccines have actually gone to their patients. They've gone to people outside of the community who are able to get there, to get on a website and navigate it, or have their friends navigate it, or whoever, and stick to it, and they finally get an appointment, and they go anywhere. So I maintain that the people who are not able to do that, which is a large portion of the population, are not being served. And I don't understand why, if you have a regional site, it's for the people in that region. And that is something that hopefully I will be able to ask the governor tomorrow.
Yes, we're all looking forward to that hearing or that meeting tomorrow. I guess, I understand the sort of inclination that, we want to set up in this region and then service the people in that region. But I mean, can there be an argument to be made that, like, as many people as we're vaccinating as possible, as long, just keep vaccinating, and eventually, it's going to be, the herd immunity that we kind of need and want?
That is an argument, and it could be a reasonable argument. The state has, however, made it very clear that they are focusing on equity. And if you're going to focus on equity, then it can't be all about speed and nimbleness. And what we've done is we've given up on the equity part, and we focused on the speed part. That's what the governor has done. So yes, our numbers are up. We have more people vaccinated than we did before. But if you look at who those people are, it's a very specific group of people. And the last time I looked, 95% of the people that went to a mass vac site are white. Okay?
Right.
And if you look at the number I just said earlier, half the 75-year-olds have not been vaccinated. So, and I would argue that that's an equity issue.
Yeah, no, that's definitely fair. I mean, I agree that, we want to vaccinate as many people as possible, but we also want to make sure that we're vaccinating everybody and not just, those
Right.
with the
so,
means.
I mean, if that's what you set out to do, then that's fine. We did not set out to do that. That was not the charge that the state assumed or was given. It was to do it to make sure that there was equity within that. And then when we didn't look good on a chart of other states, we just threw out that plan, whatever that plan was, we're not sure, but we threw it out, and then it became all about speed and large vac sites. And so that's why the local boards of health don't have vaccines.
Right.
Because it's, quote, according to this administration, not efficient.
Right.
I would argue that is not true, but that is, I think, the way they're looking at it right now.
Yeah, and I would add that I think the local boards of health that I've spoken to would also argue that that's not true. They think they can do it more efficiently than, at these mass vac sites. Because they are.
It can't be a one size fits all. I think that the administration has set up this very false choice, and it doesn't have to be. We need to do both. We need to have places where lots and lots of vaccines are available, and people can go there, and who's ever able to should go there. And then we need to have a system where the people who can't do that have a way of getting a vaccine, and we will get them all out that way. It's not an either or, but it's been set up as an either or, and that's very concerning.
Right. No, I think that's a great point. So you kind of mentioned it sort of in passing. You said the plan, whatever was the plan. That sort of dovetails into one of the questions that I had, which was, I understand that, there's probably issues that the governor is facing as far as getting vaccines from the federal level. And maybe that's not really the big issue. It seems to me that maybe the big issue is actually just communication of what's going on. Is that something that you're sort of dealing with, is just trying to get like the relevant information from the administration?
Yes, I think that is a big issue, and I think it's certainly an issue that our local boards of health have been trying to deal with since the beginning of the pandemic. Actually, there's been a real concern and issue around how things are communicated to them. Lots of moving parts, lots of things done very quickly without notice, and then being notified, after the fact. That's been a real problem for our local boards of health. But I think communication has been a very, very serious concern. Listen, this is a really hard thing to do, and I don't doubt that. And I think we have lots of people that have worked very, very hard and very long through this entire pandemic to do the right thing. And I don't doubt that. And I don't doubt that, and I don't believe there's any sort of maliciousness here going on. And having said that, we should have had a plan in place starting in August for how we vaccinate people. Some of these things would have been a challenge, and we would have had to correct our course. But a lot of this has been self-inflicted as far as I'm concerned. We knew there would be limited amount of vaccines. We knew we were putting up a website. We knew that we had to deal with equity. We knew that we had a plan that was going to make sure that we vaccinated the most vulnerable and our healthcare providers first. We knew that there were going to be lots and lots of people who wanted a vaccine. We knew there was a lot of vaccine hesitancy. All of these things we knew. And we knew them in September. We knew them in August. We should have planned for this. And what I think is most upsetting to me is that we've never seen the plan. And what it feels like is we're throwing things out there, and when it doesn't work, we're just changing the plan instead of saying, okay, we have a plan set up. The hospitals are going to do this. We're going to have mass sites to do this. We're going to have community health centers do this. Local boards of health do this. Let's start that. Where are the holes? Let's figure out how to plug them. Instead, we've made huge course changes. We've gone from hospitals being, getting, huge amounts of vaccines to 2 weeks ago getting none. We had local boards of health doing first responders, and all of a sudden they don't get any. And there's no kind of understanding of why this is happening, except that there's a ranking on a website that puts Massachusetts in a certain spot. And when that ranking came out, all of a sudden, the mass sites came out. We changed course. We stopped giving them to communities and started giving them to these mass sites, all because of a ranking system. Like, that is what you are left with. Whether or not that's true and that's the reason, that is what you are left with. And that is very, very, very upsetting, and is not the way to roll out. How does our website crash when you've got 2 million people on it? We build websites all the time that take 20 million people that are set up to, Social Security doesn't crash when you get on it, right? How many people get on a Social Security website a day? More people than are trying to get a vaccine. Why did ours crash? Why do we have a different form for every single provider on that website when you go to sign up for an appointment? Why is every one of them different? Why are they all asking for different information? Why don't we have a system where you can pre-register? Where you can go in and say, hi, I'm Cindy Friedman. I want to get a vaccine. Here's how old I am. Here's where I live. Tell me when I can get one, right? These are just questions that they have no answer, because it just leaves your head scratching. This just tells me there was no plan. And it's not that they're bad, that people are bad, but it's really, really frustrating and upsetting for all of us who are trying to get our folks vaccinated.
And do you find that, this situation surprising? I mean, I think, people kind of have an idea of Massachusetts as a pretty well-run place, and especially when it comes to medicine and, sort of our medical capacity, all the hospitals we have. Is it especially surprising that, we're having such difficulties here where, some other states are, kind of ahead of us?
So first of all, every state has had a problem. We all hear, oh, West Virginia's this, and Florida's perfect, and Texas,
No one ever says Florida's perfect.
It's a mess, right? Because it's a mess partly, in a large part, because this should have been a federal rollout, and it wasn't. The feds just were nowhere to be found. Now they're here, and that's great. Yes, some of these things are quite surprising. That we don't have a website that works is quite surprising to me. That we have such a disconnected system between the state and mass.gov and all of the providers that are out there to give vaccines it's an enormous surprise to me, because this is sort of basic website 101, right? I mean, this isn't rocket science. And it's not like we have 1,700,000 providers, right? We have a subset. We have a very, in the world of technology, the people who are giving out vaccines are available. It's a very, very small set. So to be able to normalize over that, to me, seems to be something that you could do pretty easily if you just planned it. So yes, it's a surprise. I'm surprised that we're dealing with this kind of stuff.
Yeah, I think a lot of people are. And last thing, maybe, on a more hopeful note, as sort of, the manufacturers are able to ramp up the number of doses that they're putting out there. I mean, do you see this, evolving in the next couple of months, getting to a better place where more people can, get vaccines and they're distributed more, equitably than they are right now?
Sure, I do. I mean, we are going to have more vaccines available. It is certainly one of the great challenges that we have in front of us is that there aren't enough vaccines for the number of people who want them. I would still argue that this isn't the way to roll them out, but that is a real, it's a barrier. We will see that barrier go down because we're going to have Johnson & Johnson, which is another vaccine that's going to be available. There's going to be more Pfizer, more Moderna, and we will get to a point, and probably, I don't know, the end of the summer maybe, where most people who want a vaccine will have at least their first dose. And having your first dose is a big deal, right? So I do see it. I absolutely see that it's going to get better. I know it's going to get better. I know that if we had just had a system where we said to people, we're going to tell you when it's your turn, we'll reach out to you. Mm-hmm. That's what people wanted to know. They want to know, do you know I exist and am I going to get a vaccine, right? So I think that it's going to become easier to get that vaccine. We're going to clean up some of this stuff that has made people so worried. So I do absolutely see that it's going to get better, but this is not going to be our last pandemic. No. It is not going to be the last time that we're going to be doing this. And if we don't learn from this, and we don't hold people accountable for doing a better job going forward, shame on us.
All right. Well, we started off a little hopeful in that last question, then you kind of went a little down with future pandemics.
I'm sorry, you're right. People are going to get vaccines and they are going to be able to, to go out and meet their family, and that's going to happen. And it's probably not that far off. I think you're hearing from somebody who's been dealing with this since last March, the beginning of March.
Right.
As the healthcare finance chair, as being on the advisory committee, as being part of the COVID-19 working group. I and a number of my colleagues are so immersed in this that, you're seeing people go, but,
No, I
but
get it.
every people are going to get their vaccines, and we are going to be able to return to some level of normalcy. And I don't think it's going to be in a year. I think
Okay.
it'll be much sooner.
Well, we all hope so.
How's that? Was that
We-
better?
Yeah, it's better. We all want at least a little bit of the summer to have,
Really.
to have some fun.
And you've got a great group of people in Burlington. I mean, the Board of Health and your public health directors, they're wonderful. And
Yeah.
they are working so hard for their communities, and you are well served, and you have a real voice. So, good for you all, and that really matters.
Yes. Well, I agree. They've been very good. And I know you've been in the thick of it, like you said, since last March, and I appreciate you taking some time to talk about it today and sort of give people an update on kind of where things stand and where we're going. So thank you very much for your time, and I'm sure we'll be talking more about it later. But for now, I appreciate you coming on.
Sure, it was good to see you.
You as well. So there you have it, the current state of the COVID-19 vaccine rollout in Massachusetts and the issues facing local boards of health. I'd like to thank my guests, Burlington Health Director Susan Lumenello, Board of Health Chair Dr. Ed Weiner, State Rep Ken Gordon, and State Senator Cindy Friedman for joining me. I'd also like to thank all of you for watching. We'll be back with another edition of BNews In Depth next month, so stay tuned.